welcome. Welcome, everyone. Thank you. Thank you. The show is Health Access. My name is Akin Fadeyi. Nigerians have always complained about one thing or the other. We complain about light, we complain about water, we complain about skyrocketing prices of food. What is it we haven't complained about? But there's something Nigerians will soon be very proud of. You want to know? Yeah. Good. Let's just get the show rolling.
Circumstances such as these, ranging from the outright comic to tragicomedy and crushing defeat, informed the decision of the federal government to establish the National Health Insurance Scheme with the NHIS Act 35 of 1999, in line with best global health practices to bring relief to the people, rich or poor. The health of a Nigerian and access to health facilities being a key consideration of the President Goodluck Ebele Jonathan administration, he launched a dedicated search that left no stone unturned, subjecting all applicants to a rigorous selection process. He wanted a person of purpose, an astute manager, and uncompromising professional to drive the presidential universal coverage mandate of enrolling at least 30% of the Nigerian population on the National Health Insurance Scheme by 2015. That search led to a man who has his roots in the sleepy little town of Ekiti in Ekiti State.
He's a professional and a highly skilled one too. I think he's one of the most dedicated professionals Ekiti and Nigeria has ever produced.
The president, in sound wisdom, gave the responsibility to ensure that every Nigerian, old or young, rich or not, is covered by the National Health Insurance Scheme in record time. A man of vision and dedicated purpose, a team player and an incurable stickler for professionalism, a leader with the people as his primary constituency. This is the man saddled with duty to guarantee that should Nigerians be in need of medical health anywhere in their country, their power to access health service written on an insurance card guaranteed by their government ensures that they will not be denied. Let us welcome the Executive Secretary, National Health Insurance Scheme, Dr. Martin Folakemi Thomas.
The president gave you a mandate to deliver 30% health insurance coverage for Nigerians, correct?
Very correct.
You upped the ante by giving yourself 40% coverage target, correct?
Correct.
Nigerians don't believe you.
Well, I can understand. You see, first of all, I like to welcome everybody to this very important occasion. It's another opportunity for us to look at what's on ground and interact, educate everybody about what is in the pipeline. Even in the developed world, there are people who will not believe in health insurance. You see a situation where somebody is asking you to start paying for what you don't need immediately. You see a situation where somebody is saying you want to put money down somewhere to take care of your health when you'll be sick. In Nigeria, people see it as a taboo to start wishing people that they will be sick one day. That's an important issue when it comes to health insurance coverage anywhere in the world, Nigeria inclusive. But in Nigeria, it is true that this scheme has been on for how many years now? 9 years of actual rollout. And the scheme, they decreed that the law had been signed since about 15 years now. And people are wondering what has been happening. Now, when you talk about health in Nigeria, in Yoruba you say Ilera. In Igbo land, I don't know the meaning, but also the same in Hausa. But the truth is that you are talking about being well. The whole essence of what we are doing is a form of social solidarity that will guarantee our health. That is, the rich, the poor, everybody putting money into one basket. to guarantee our health. So it's like we are preparing to help ourselves and to help everybody. That is health insurance for you.
There has been low patronage
Yes.
of health insurance in Nigeria. How do you hope to make Nigerians key into your vision?
Right. Well, there are many sides to this same question that you have asked. First, let's start from the vision, which has now been translated into a directive by Mr. President. Mr. President is saying at least 30% of Nigerians should be covered by the end of 2015. Within us, after doing the situation analysis, we felt, even we can hit 40. But to do this, you need a strategy. And what is the strategy? First, you start from your home. Since 2005, federal government has been paying a percentage of workers' salaries for health insurance for them. And the workers are supposed to add just half of that. But they've not been able to do that. Again, you see the NHIS as a body that is supposed to demand this from people. And that body was not even contributing. So where is the moral platform to ask people to contribute? That we have sorted out now. I started by saying, please, from the time I joined this scheme, my own deduction should start. And I told people who are working with me at the top management committee, if you want to share this seat with me, please contribute. And they've all started. Even the workers of NHIS came together and said, yes, it's time for us to do our own part. And so they started contributing. Then you look at the wings, the strength of the organization. We did a proper assessment, I think, with the help of IFC and Accenture. They've assessed us. They've come up with some recommendations as to how we can improve on what we are doing. We have created more departments. We have opened offices in all the states of the Federation and 7 zonal offices. I have people thinking that maybe by the end of next year, we might be hitting local government areas because this thing has to be taken to people's doorsteps. That's that. Then an important element that was missing was that of marketing. There was no department of marketing when we came in. And we said, how can you do insurance of any kind without marketing? So now we have a department of marketing.
Thank you, Dr. Thomas. In case you're just joining us, on the hot seat has been Dr. Thomas, the Executive Secretary, CEO.
It is not hot.
Yeah. Once again, the program is Health Access. We'll have a short break now, and we'll be right back.
She fine pass Oyinbo queen, no rival.
Baba, your wife is coming.
Hospital bills.
Da kin yi register da NHIS. Da yanzu ba kya asibiti bill. Ìbá ṣe pé wọn náà ti darapọ̀ mọ́ ètò ìlera adójútòfò NHIS ni. Ó ní máa pariwo owó hospital bill.
Ọ bụrụ na ị dere ahụ n'akwụkwọ ndị NHIS, ị gaghị nọrọ ebe a na-eti mkpu hospital bill.
And my dreams dey always come true. I dey go register for the NHIS.
What do you know about the SES?
Na NHIS. Government don dey arrange better thing wey you go benefit from. Me and Linda, we no go dey suffer for hospital bill again.
NHIS, easy access to healthcare for all.